Knock, knock. Can I come in?
Yes.
Hi, I'm Justine. You met me earlier.
Yes.
I'll be your nurse. I'm just gonna assess your head and your eyes and your nose and your throat and listen to your lungs. Okay?
Sure.
Okay, so can you tell me your full name?
Deborah Saunders.
Do you know where you are?
Yes. I'm at a doctor facility.
Okay. And I'm just gonna wash my hands so that we can get started. Everything going well for you this morning?
Yeah.
Okay. And then I have all my equipment here to use throughout. Set this back over here. And I'm going to be doing some mental assessments throughout the assessment, but I'm going to start out with a few in the beginning. So I'm going to be looking at your physical appearance and your behaviors, and then her cognitive abilities, her speech and language, and her emotional stability. So the first question I'm going to ask is, I'm going to have her look at this, and she's going to tell me which is going to be next in the sequence. So the top here is the pattern, and then pick a shape.
All right. So the next would be a square.
Okay. And then can you tell me what 36 plus 25 is?
61.
Mm-hmm. Do you remember what shape you picked?
Square.
Okay. Do you have any feelings of depression or anxiety?
No.
That would be like persistent sadness, hopelessness, feeling empty.
No.
Okay. Do you see things that aren't there or hear voices?
No.
Okay. We just have to get through those kind of weird questions. Then I'm going to do your vitals. Bring my thing down here for lack of a table. So what is your date of birth?
8/6/58.
Oh, there's my pen. That would make you 60.
Yes.
And then before this, we did her height and weight, and her height was 5'5", and her weight was 146 pounds. So that would make her BMI 24.3, which is normal. And you calculate BMI by the height in inches, weight in pounds divided by height in inches squared times 703. And then I'm gonna get your temperature. Wait for this to set it up. See if it wants to work. So this is gonna go on your temporal. .98.3. I'm going to do her respirations while she's not knowing, while I listen to her heart and check her pulse. Okay, so first I'm going to do this. And then I'm just going to feel for your pulse here. Okay. I'm gonna take your blood pressure here. Do you have an arm you prefer?
No.
Okay, so I will stick it on this side. If you can just lift it out a little bit. And then relax it at your side. This right here. I'm gonna get kind of tight here. Okay, 112/62. Do you have any pain today?
No.
0 pain. Well, that is a good thing. And then I'm gonna get your oxygen saturation. This is just gonna go on your finger. If it wants to work. Okay, let's pick this one. Sometimes this thing okay, 99. That's very good. So over here, so now I'm going to look at your head. Can you take your hair down for me? I'm just going to look at it, and I'm just looking for lesions or parasites or bumps. Take a look at your forehead here. Now if I saw some temporal arteries, I could listen to them with the bell of my stethoscope. And then I'm just going to feel. Is there any tenderness there?
No.
Okay, I'm just gonna feel your forehead here. Okay. And then, let's see. I'm gonna feel for some sinuses. So there would be one here, and one here. And I don't feel those. Do you have any headaches?
No.
Okay, and I'm just going to look at your facial features to see if they're symmetrical. Okay, so next I'm going to go on to your eyes. Do you wear glasses or contacts?
Just reading glasses.
Okay, so I'm going to put some hand sanitizer on. And I'm going to feel for the gland that's above your eyebrow. Okay, right here. And then I'm just going to look at your upper lids. Close your eyes, please, and your eyebrows. And I'm going to look underneath in the orbital area for some swelling. Now, for the sake of this demonstration, we're going to pretend that this is the reading card. And I'm going to have you read this, the smallest line. So first I'm going to start far back.
With my glasses or without?
Without them, because they're your reading glasses. So read the smallest line. Is that too far? Let's try a little closer.
The bottom line says total points earned.
Okay, good. Okay, so now I'm going to put it closer to your face, and then you can use your reading glasses. And then
Total points earned the second line above that, total points possible.
Okay, great. Now, can you cover one of your eyes and then with your glasses on, and then read it and tell me, now do the other side. Do you notice any difference?
No.
Okay. Now I'm going to have you look into my eyes, and I'm going to hold up fingers, and you're going to tell me without looking at them how many I have.
2 and 4. No, 2 and 3.
Okay, so then that would be 5.
5, yes.
Okay. Okay, so I'm going to have you follow my finger with your eyes. So I'm going to start up here. And then I'm going to come a little closer. Okay. Now could you take your glasses off for me? Where is my pen light? Okay. So I'm going to come closer and you're going to do the cover one and then uncover the other. And then I'm going to watch your pupils, okay? Uncover. Now do the other eye. Okay, uncover. Okay, and now I'm just going to shine this light in between your nose. If you could look at this right there. Okay. Okay, and so now I'm going to shine the light into your eyes, so keep looking there. I'm going to do it twice. To this side. Very nice, very nice. Now that I've blinded you. Okay. Okay, so now I'm done with your eyes. I'm gonna look at your ears. The first thing I'm gonna do is just take a peek at the outside and the inside a little bit, and look at the other one. Okay, so now I'm going to feel them, and you tell me if they feel tender at all.
No.
And I'm going to feel the mastoid gland behind your ear, and tell me if that feels tender at all.
No.
Okay, so for the sake of the demonstration, this is going to be my otoscope. And I'm going to look inside your ear, and I'm going to look at the auditory canal and the tympanic membrane. Okay. I'm going to do this test where I'm going to rub my hands behind your ears, and you're going to tell me if you hear it or not. Okay.
Yes.
Okay, so her hearing is normal, so I wouldn't do the tuning fork test, but I can show you how I would do those. So the first one I would take, this one is the Weber, I would take this and tune it and stick it on top of my head, and I would ask the patient if the sound is equal in both ears or different, and a normal reaction would be the same. And then the Rhine test, I would take the tuning fork and stick it on the side of the mastoid and have the patient tell me when they stop hearing it, and then place it over the ear a few centimeters away and tell them to tell me when they stop hearing it. And I would do that on both sides, and a normal reaction would be the ear conduction would be twice as long as the bone conduction on the mastoid. Okay. I'll get back up here. Okay. So I'm gonna do your nose now. So I'm just gonna look like the others, and then I'm gonna feel. Do you feel any tenderness?
No.
And then I'm gonna feel the frontal sinuses, And the maxillary sinuses, are those tender to you at all? Okay, and then I'm gonna take a look inside your nose. So if you could just tilt your head a little bit back so it's comfortable. I'm looking for any abnormals like lesions or deviated septum. All right, that looks good. And then I'm going to do your mouth. So I'm gonna wash my hands again because I'm gonna have to touch your mouth. Oh, one thing I forgot was, can you take a deep breath in your nose and out your nose for me? Okay. And then I'm gonna put some gloves on. First thing I'm looking at is your lips, and then I'm just gonna palpate them. And if you could open your mouth for me and smile. Okay, I'm going to look at your gums, and then I'm going to look at the inside of your lip. And then I'm gonna look at your cheeks, and I'm gonna feel your cheeks. Are those tender at all?
No.
Okay, and then I'm gonna take a look at your teeth. Just looking for any missing teeth, infections, or whatnot. And then, can you touch your tongue to the roof of your mouth? Okay. And then put your tongue down. Open your mouth. Okay, now stick your tongue out and say, ah, ah. Okay. And now I have to palpate your tongue, so stick your tongue out. Okay. Now for this, I'm not going to do the gag reflex for this, but that would be where I would take my tongue blade and I would put it on the posterior wall of the pharynx to stimulate the cranial nerves. That would be the hypoglossal and vagus nerves, to see if those have a reaction. And the typical reaction would be symmetrical. And then I'm going to take, once I'm done touching the inside of the mouth, I'm going to take my pen light and I'm just going to look at the back of your throat, okay? You stick your tongue out for me, okay? Uvula, tonsils, looks nice and pink, just like it should be. Okay. So, let me think here. So then the next thing I'm gonna look at is gonna be your neck. Okay, so I'm just gonna look here. And then I'm gonna palpate and I'm going to find your trachea, which is right here. And then I can also look at it like this. Okay, and then I'm just gonna feel down here for the lymph nodes. And then I'm gonna check the back muscles in your spine. Any of that feel tender to you?
No.
Okay, now I'm going to look for your thyroid, so you're just going to put your chin up just a little bit. Okay, and then I'm going to find the bony prominence here and go just a little bit lower. And then I'm going to extend out and feel for it with gentle pressure. Now the right side's going to be a little bit larger. Okay, so I'm going to have you swallow for me. Okay, good. Now, if those were enlarged, I could listen for bruits with the belt of my stethoscope. Let's do some range of motion. Can you touch your chin to your chest? Now look towards the ceiling. Okay, now put your ear to your shoulder, the other ear to your shoulder. Okay, now put your chin to your shoulder, and then repeat that with the other side. Okay, any pain with that?
No.
Feels good? Okay. Okay, so one thing I'm gonna do is I'm going to put my hands on your trachea again, and then I'm gonna have you swallow, and then I'm just gonna sit here and see if I feel a tracheal tug, and that would be like a pulsing sensation along with your heartbeat, and that would be abnormal. Okay. Okay, so now I'm gonna go on to your lungs. Your lungs are like an air sponge, and they have millions of little holes that soak up air, okay? So first thing I'm gonna do is look, like with everything else, and I'm looking for color, symmetry, noticeable ribs. Let's see here. Do the same with the back. Can you lean forward just a little bit? Okay. And then I'm just gonna palpate. You can breathe while I'm doing this. I'm feeling for vibrations, which would be not normal. Okay, okay. Down here. Okay. And then I'm going to do a couple tests. One is called the thoracic expansion. So I'm going to go, if you could scooch forward a little bit in your chair, I'm going to go to the 10th rib, and I'm going to stick my thumbs together like so, and I'm going to have you take a deep breath, so I'll let you know. Okay, breathe in, out. Okay, and the normal reaction would be for your thumbs to separate a little bit, and they did. And then another test would be the diaphragm excursion. Now this one's kind of interesting, where you kind of have to hold your breath, and then I'm going to percuss down your back. I'm just going to press, and I'm looking for the change in resonance and dull.